Hello everyone. In our series of Docplexus KOL interviews, today we have with us Dr. MC Gupta.
Hello.
He's an MBBS and MD in medicine and has been a dean and professor. Post-retirement, he changed his profession and joined the bar in 2001 as a lawyer. He takes up medico-legal cases for both patients and doctors, and his legal expertise has been sought by several IMAs and other association of doctors. He has been awarded the National Citizen Award in 1992 and is a fellow of the National Foundation of Clinical Forensic Medicine. Thank you for your talk today with us, sir.
Thank you.
It is quite often that people relocate but still visit the doctors of their native place, or the doctors who have visited them before, or they've taken consultation from them before, and they use social media platforms like WhatsApp, Hike, or even through emails to take consultation from these doctors. So is it valid medico-legally, and what should be done by the doctors in such cases?
You see, the golden rule is that if I advise a patient something, then I have to face the consequences of that advice if the patient follows it. As a doctor, every doctor knows, as a doctor, it is not possible for me to judge the full clinical spectrum of the patient without talking to patient directly, without having a look at the patient, without examining the patient. And if in such a situation, when somebody just calls me or on social media, he poses a query and I advise him, then firstly, I should politely tell the patient that no, I cannot give you advice in such a manner unless you come and get examined by me. I advise that you may go to some local doctor, whosoever is your doctor there, and get treated by him. Number two, when I give such advice, if it is on email, etc., where it is recorded, I must make a sort of waving statement, waiver, that this advice has been given without examining the patient, and it is not to be taken as advice, and the patient is advised to visit me and show me or to some other doctor. It is not a medical advice. Because it is sometimes, even though we do it in good faith, but sometimes the patient can misunderstand my advice. I tell him one tablet once a day, he may take one tablet 10 times a day. I advise a tablet of 5 milligram, he may take 50 milligram tablets. So all those things can happen.
And what if such a case is taken into the court, and what is the course of action in these situations when some doctor has prescribed a medicine or given a diagnosis on a social media platform without examining? If such cases turn up, how is it taken?
In such a case, about a court as such, I would be held responsible for giving an advice which I should not have given. If the case goes to medical council by way of complaint, the medical council will hold me responsible. And in these professional matters of scientific, medical, technical nature, the courts usually go by the advice of the professional body, that is the medical council in this case. I have no doubt in saying, I have no hesitation in saying that in such a situation, where a doctor prescribes a medicine on social media or on email, etc., such a situation will never be allowed or agreed by the medical council. The medical council will hold the doctor for violating the code of medical ethics for advising a patient without seeing the patient. And once the medical council does it, the courts will agree to what the medical council says. So the answer is, the doctor should avoid prescribing anything to any patient without seeing the patient physically in their chamber.
So can a doctor declare if the patient has TB to the relatives or anyone accompanying the patient?
Okay, I will answer it like this. Suppose the doctor declares, when there are 5 people have come there, visiting the patient on the bedside, and it tells to the group of 5 that the patient has tuberculosis or cancer or AIDS, whatever it is. And suppose after 10 days, that patient sends a notice to the doctor that you announce the whole world, you announce to people about my disease, you broke the concept of confidentiality between the patient and the doctor. Because you see, as per the code of medical ethics, a certain confidentiality has to be maintained between the doctor and the patient, and the doctor is not supposed to divulge the secrets of the patient to others. And this is a secret, no? At this point, nobody knows till today what was the disease, because my disease is my confidential thing. So if such a if such a patient gives a doctor a notice that you breached the terms of confidentiality, he can very well, the patient can very well fight a suit against the doctor for defamation. Also, you can complain to medical council for disciplinary action against the doctor. So the answer to your question is no, a doctor should not do that.
So it should not be for any disease and not just for tuberculosis,
Yes.
basically. So if a female patient puts up a charge of molestation against a male doctor, is the police empowered to arrest him, and how should the doctor take care of the situation?
Number one, the police is empowered to arrest him because such an offence would be a cognizable and non-bailable offence. Cognizable means that the doctor can be arrested by the police directly without an order from the magistrate. Non-bailable means that the bail can be given, of course, later on, but the police cannot give bail. You see, what happens in ordinary instances, the police arrest and the bail is given at the same time by the police in the police station itself. A person comes home after giving the surety, etc. So when we say non-bailable, that means the police does not have power to grant bail. This person will be in lockup and a case will be reported to the magistrate. He will apply for bail to magistrate, and the magistrate may give or may not give bail. So it is non-bailable in that sense. Bail may be given by the magistrate, by the court, but not by police. So that's the answer to first part of question. Answer to the second part is that a doctor should take the following precautions to avoid such a situation. Number one, not to examine a female patient in the absence of another female, another lady, whether a staff or non-staff. A staff nurse or some other lady doctor, maybe some class 4 helper of the hospital, or maybe even another patient, some attendant. So that is the precaution number one. Precaution number two, that if we have got some audiovisual recording in my consultation chamber, unless I am examining private parts of some patient, that's a different situation. So if I have a system of video recording, certainly once that video is there, then the patient cannot make a false charge that I have misbehaved. Only with the proviso that such video recording should not be done clandestinely. It should be with the knowledge of the patient. Okay.
Dr. Gupta, how do you think an online platform like Docplexus can help raise awareness about medico-legal issues in doctors practicing today?
Okay. I would say that not only awareness plus knowledge, because being aware being aware that there is a thief outside, and if I don't know how to fight the thief, so that awareness also becomes only part awareness or partly useful. So how a platform like Docplexus can help in increasing the awareness and knowledge about law amongst doctors, I think the best and clear answer would be that the Docplexus may locate someone who is specialist in law and who is a doctor, or in other words, is a medical legal expert. And whatever questions or doubts the readers may have, and they send to Docplexus, the Docplexus can transmit those queries to the expert and he can answer them. That would be the best thing. And the real best thing will be, when I say medical legal expert, I must qualify what I mean by that. As per realistic estimates, I once estimated, there are about 10,000 doctors, MBBS doctors in India who are LLB. All of them can't be called medical legal experts. There are about maybe 50, 60, 70 doctors in India, or maybe 100, who are continuing to act in their medical profession, but as a side activity, they have also studied law and they keep on advising doctors and others about law. So it is good. Some of them have done PhD also, but they continue to practice medicine. A best medical legal expert would be that a person who has been a doctor and who has joined the bar, who is an advocate in the real sense, who argues cases in the courts. So it is for the Docplexus to choose the person and to locate a person. So the best strategy would be to get the question answered by an expert.
Thank you, Dr. Gupta, for your valuable feedback and for this interview.
Okay, my pleasure, Pankaj. Thank you.
To stay updated on our latest scale videos and interviews, please follow us on Twitter, like us on our Facebook page and subscribe on our YouTube channel. Happy Docplexing!